Thank you for joining us on voicesacademy.com. This video is a companion module to interpreting in physical therapy settings. Our guest is Mary Sondag, who is a licensed physical therapist with South Coast In-Home Therapy Services. Thank you for joining us today, Mary.
Thank you. It's my pleasure.
Now, what we're going to be doing are some demonstrations of exercises and simulations of things that might happen actually in a physical therapy setting. So we have a member of our crew who we will be using as our patient. Mary will be demonstrating, and I will be positioning at times as the interpreter, and she's going to be explaining things to me as though I were an interpreter, so that as interpreters we can understand the types of things that the therapist is thinking in her mind, as well as the types of instructions that she may need to give to the patient.
Okay. Okay. This patient had shoulder surgery about 6 weeks ago. He had torn his rotator cuff, which is muscles that attach to the arm bone here, the shoulder bone, and he had torn them, and so they needed to go in and repair those. So what happens is they put a sling on him. He cannot move for 6 weeks. So now the doctor has sent him to me because he can start moving. The only thing is he cannot move it himself. At this point, the doctor only wants me to move it, the passive motion. So I'm going to take his sling off. Now I want you to know that he hasn't moved the shoulder in quite some time, so he's probably a little scared and it's probably going to hurt. So the first thing I'm going to ask him is if he took his pain medication before he came.
Good question.
Okay. I probably will have done most of the history taking part of the eval, and I will have put a hot pack on him to warm him up.
Okay.
Warm up that shoulder. And now I'm going to take the sling off. And don't worry, I'm going to be very slow and very careful. Normally we would have some pillows. His head would be in a pillow, probably be pillows under his knee, and I would also have a pillow right under here. But for now, it's just going to be me.